The number of people going to the hospital with COVID is going up at the Texas Medical Center and across the state. Chris Costa explains why doctors say this trend is important to look at even if you're not infected yourself.
When we talk about hospitalizations, the number of people in the hospital with COVID-19, we're not just talking about people being sick.
This number is very important because it really drives our outcomes on the possibility of surviving and getting over this disease.
Yes, hospitals can flex regular beds into ICU beds, but even with help from traveling nurses, there is a breaking point.
People do very well when they get the standard of care, and outcomes start deteriorating when we go beyond that.
Right now, the Texas Medical Center reports more than 1 in 4 COVID-19 patients are in the ICU. They're reporting an almost 40% increase in hospitalizations in the last 2 weeks.
You're working in a hospital and seeing people very sick and families devastated, and you're driving back home and you see people in bars and restaurants and partying, no mask. It's pretty demoralizing.
Right now, 9.65% of hospital patients in the Houston area have COVID-19. If that number goes above 15% for 7 days or more, bars would close and elective surgeries would be put on hold, like in the Dallas-Fort Worth area on Friday.
People that deny COVID or don't take COVID seriously are people that are not seeing deaths and sickness around them. Just because you don't see it, it doesn't mean it doesn't exist and it's not affecting your community.
The good news? Vaccines should arrive in time to inoculate healthcare workers and at-risk populations as cases are increasing.
And if there was ever a time to say the cavalry's coming, it's this time.
But that does not mean the rest of us can let our guards down and ignore our healthy habits. In Houston, Chris Costa, KHOU 11 News.